The rollout of HIV care and treatment as a country was informed by the work that was done under the Drug Access Initiative. And under that, that's where the medical access was formed. It was formed as a way of negotiating, bringing prices lower for the cost of ARVs. Because at that time, I think a cost of ARVs for 1 month was costing around $1,000. And under the Drug Access Initiative, the drugs were reduced so that a few patients could be able to access them and pay for them. From as early as 2000, we started rolling out treatment programs and also PMTC programs. And for care and treatment, especially the rollout of the free program started in 2004. And by 2005, we had gone across all major hospitals of the country. So we've seen a lot of scaling up for HIV care and treatment.
Scale-up program started, access to medicine started. A lot of institutions came to support the Ministry of Health, particularly CDC, under PEPFAR program.
The Procurement and Supply Chain Strengthening Project is a PEPFAR-funded project through CDC that was awarded to Medical Access in September 2011. The goal of the project was to centralize procurement and supply chain of HIV commodities, which previously was awarded to different implementing partners through their cooperative agreements. Health commodities were being provided to same hospitals by different partners, while other hospitals were not being provided with any commodities. The prices were different, the commodities were not following any guidelines or standards, and so it became clear that there was need to centralize procurement and supply chain for PEPFAR under CDC in Uganda. And that's the advent of the Procurement and Supply Chain Strengthening Project.
PSSP was established to support procurement and supply chain management of the HIV-related commodities. So this means that we are responsible for forecasting, we're responsible for procurement of the commodities, budgeting, and then replacement of the orders. We're responsible for custom clearance of the goods when they come from the suppliers globally. Then we warehouse them in our ISO-certified warehouses located within Kampala. And then on receipt of the orders, these commodities are distributed. We distribute them directly, including last-mile delivery to all the facilities that are supported by CDC and supported by PSSP project, including reporting as well. So this is what we refer to as a procurement and supply chain management.
Medical Access is proud to have participated in the procurement of equipment for starting up the National Health Laboratory. The National Health Laboratory is a newly constructed national lab funded by CDC that supports the laboratory sector in ensuring that there is adequate diagnosis, research, testing to ensure that diseases and disease surveillance can be strengthened in this country. We are able to procure equipment worth over $1.5 million to equip this laboratory to be able to be functional and serve the people of Uganda.
Medical Access has state-of-the-art warehouses equipped with biometric security systems for access control. Currently, we are operating with a pallet space of about 4,750. We have 5 separate cold rooms for our cold chain storage. These are run independently and also have 3 power backups. When we receive an order, we have a team that runs quality checks on the order to ensure that there is rational use of the drugs and that every commodity is ordered for. So by the time the order is coming to the warehouse at Medical Access, it is a true representation of the patient needs at the health facilities. What we do also is we consolidate these orders in terms of vehicle routes so that we can deliver value for money, but deliver also at the smallest bulk possible. That we have in total a fleet of 20 vehicles. Of these, we have 3 cold chain capable vehicles. Basing on the size of the orders, our largest vehicle so far is one capable of carrying 10 tons, okay, to the smallest that we have that is able to carry 400 kilograms. So as Medical Access, we have also ensured that no commodity is delivered by a single person. Now this brings in the aspect of commodity security. We ensure that For every delivery, for every consignment, there is a driver and there's a distribution executive. That way there's a stronger presence at delivery.
Yes, how are you?
You're fine, how are you?
Thank you for coming.
Welcome.
How was the road?
The road was bad, completely bad.
At least you have arrived on time.
Thank you very much.
Before we had issues with the stockouts, so you could place orders even for 3-4 consecutive cycles, but you'll never get the drugs or the testing kits. So every time we are running short of ARVs, test kits, for even 2-3 months, no drugs, no test kits, you cannot do the HIV testing. It depended so much on borrowing here and there. And since medical access came in, things stabilized. And of course, with medical access is more of a pull system. You only request what you need. They don't give you access that is going to get destroyed within the facility. So it was really a good practice. Our patients are very happy with the service because every time they come, they are able to get the drugs. Having Matanyi, serving the whole population, especially within Karamoja region, everyone prefers to come to Matanyi, and we have very many clients coming from other districts who want to come and get their service because of the steady supply of the drugs and even HIV kits, which are always available at any given time.
The sites that have been supported by medical access have really done very well in terms of commodity security. They've always had enough stocks, and the capacities have been built for those sites. When it comes to reporting, we have a web-based reporting system. The sites that are supported by medical access have the highest reporting rates, and they order on time. They never run short of drugs. There's always been timely ordering and timely distribution of drugs when you compare them to the other warehouses.
Due to the accessibility, constant availability, the option B+ in TSMP has led to safe deliveries, because ever since we started option B+, we have only had 3 babies. We have never registered any positive case. So it has enabled Teso Safe Motherhood to produce children free out of HIV, and mother status being improved from ill to be fine, strong, and promising to live.
The second goal is related to strengthening the supply chain systems that will ensure that the commodities are effectively and efficiently utilized. What this entails includes training the healthcare workers to ensure that they are able to manage the commodities properly, to ensure that they are able to forecast the commodities. The other aspect is also that we support the infrastructure improvement. We have supported a majority of the sites, over 220 health facilities that we support, by upgrading their storage facilities. So we have equipped them with modern shelving facility. We have equipped them with computers to enable them be able to report and also record the information in an electronic manner. We have provided flow pallets. We have provided standard operating procedures. We have also equipped them with digital electronic thermometers that can enable them to be able to monitor the temperature, which is a key requirement in ensuring that the commodities are kept within temperatures and conditions that are recommended by its supplier. The other aspect also where we have invested in strengthening the systems is also the laboratories. So we have supported the Ministry of Health to strengthen the infrastructure of the laboratory hubs across the country by providing equipment that perform different tests ranging from chemistry to hematology to CD4 monitoring, as well as support in terms of viral load and monitoring as well. So this is the second goal.
We have actually appreciated the value of having specific information like data. That data is the basis for which we are supplied. So if the data is correct, then you get the right supplies. In that case, you don't have too much in your stores, you don't have too little in your stores, you just have the right quantities. And this has been through a lot of mentorship programs, through supervision. As you make a report, you find the field officer from Medical Access comes in and ensures that that report is actually accurate according to the information that you've given as compared to the information that you have, the physical counts.
The support supervision model that is currently being implemented is a mentorship and technical health system strengthening model that has 8 regional field officers supporting the 5 regions in Uganda. Part of the capacity building initiatives that we have been able to carry out have been the on-the-job trainings with the health workers at the health facilities. We have provided supply chain management trainings regionalized to suit the needs of the sites within each region.
Because we say our maximum stock level is 4, so it's 80 packs. So we shall write maximum stock level 80 packs.
They went us through, first of all, a one-on-one mentorship training. It was on job. They could drive here week in, week out. That was Sarah leading the group mostly. Fortunately, the first time she came in the clinic, she found me on duty. And it was really an embarrassment because we were putting our drugs on the floor.
So when I first got there, I found out that the storage was compromised. This was inappropriate storage for our HIV commodities. I could see that we were risking having losses or wastages at the facility. So I had to engage the in-charge together with the storekeeper and explain to them what needs to be done. How should these medicines or cold chain items be stored and what is required for them to meet that standard of good storage practice.
From onwards, we initiated ourselves into the practice that no, medicines are part of people's lives and they must be kept in the most safe state.
I just remember that time when I came to Uganda in 2010. I was still working in another hospital, also in the field of HIV, but it was hunting for ARVs. We were not able to keep the patients on the same line. Since we are working with medical access, it never happened that the patient went out of our gate and didn't get the treatment. The support is not only in the delivery of the reagents and of the ARVs, Cetrin and fluconazole, but also for the support supervision, for the management of the laboratory and for the management of the store. When you don't know where your gaps are, it is not easy to improve. And thanks to the field officers of medical access, we have been able to identify what is wrong, what is maybe not so good. So we are very happy that we were able to improve in those years when we are working together.
One of the major challenges that we had identified was lighting, which was a very big problem actually. We were previously using kerosene lamps to help in the lighting at night and during power cutoffs. Even during times of load shedding or when we don't have power, we were cut off from running a number of tests in the laboratory. Our vaccines sometimes would get spoiled or would transfer them to other facilities that could have power. Our corridor was always filled with the fumes from kerosene as it burns, and it would fill the whole facility. Thanks to the Centers for Disease Control through medical access that supplied us with a solar power system to our facility. So this solar power system lightens up to around 30 bulbs at the facility. It works in the laboratory, then in EMTCT, giving birth to mothers in the correct way, without challenges in power, and also keeping the vaccines safe in the fridge.
Ever since medical access came into play, we've been able to offer free services. We do free HIV testing. For everyone that needs the test, we go to outreaches and do outreaches. Medical access has been very supportive and very, very punctual as regards our orders. They never make mistakes with our orders, and they always deliver on time. When you press in an emergency order, they follow it up. If something goes wrong, they always make sure they get in touch. They call you and remind you of what you're supposed to do. For example, the physical counts at the end of every month, because we do it monthly. They come for supervision, check whether we are doing the right things. They empower our staff. For example, if a person goes for training, of course they tell you to come back and train your staff. So they come and follow up on those staffs, how have they been trained, and they also ask them, are you doing the mentorship with the other people that have stayed behind?
nga ndi founder Kawempe Home Care era nga ekitongole kino kyatandikira mu maka gange mu mwaka gwa 2007. Kyali ekigendererwa kyange kyali okuyamba community. Abantu bange bannange baali bubi, Kasangati yali bubi nnyo, abantu baalinga beekweka, baalinanga stigma nga batya. Naye Mukama n'atukwatirako nampa Dr. Sam. Dr. Sam natweyungako nembawo ennyumba yange era baabeerewanga okumala emyaka 2.5. Ndi musanyufu nnyo okuba nti nali founder ate nga ndi positive, ndi mukyala ali ku ddagala, kyokka ate nga ne bannange bwe nabakuŋŋaanya ne basobola okunneegattako. Sintu si kyangu ogenda okuyita mu bantu mu kyalo ne bakuwuliriza. Ne bannange bampuliriza ne bajja ne batwegattako era kati ku ssaawa eno tulina abammemba abaclient abasukka mu 2,000. Abantu basanyufu nnyo era bejjiranga bwe baagala ne mutuuse wano olwaleero abantu bejjiranga bwe baagala tulina kumanya nti omuntu alina akawuka. Bafunye obujjanjabi bulungi nnyo era medic access tubeeyanzizza nnyo bannange. Tuli bulungi era tulyagadde era mutuyambye kubanga tetubulwangako.
We've progressively scaled up this project from 39,000 patients to currently at the end of the project serving over 248,000 patients. The IPs have also expanded from 3 IPs in 2011 to 14 IPs by the end of the project.
Since for the last 5 years that this project which is ending, they have procured efficiently and delivered timely. And even their prices compare very favorably with those who are benefiting from economy of scales. So to me, that's a big lesson. If a company, a local company, is well managed, can also do equally well, even better at times than what the international company.
If the products are consistently available and the patients are getting them, that means that we're also reducing the risk of development of resistance, but also the patients, meaning that they have their medication, they will stay consistent on the medication, and they are able to improve the quality of their life, and they can live a normal life.
Thank you so much for all you have given to us. I'm just very grateful.
Bannange medic access kyemutukoledde Mukama abawa omukisa ate bannange Mukama abawangaze abawe byonna bye mwagala kubanga mukoledde Kawempe Home Care. Thank you very, very much.